What's going on, guys? Dr. Andrew Fix back here for another episode on the code. If you're watching the video to this, you'll notice that it's a bit different. We are sitting inside the sauna for this episode, and something came to my mind right before I decided to hop in here. So I just decided to bring the mic with, and let's get after this conversation, okay? Because we're talking about taking better care of our health and being in charge of our health and being your own advocate for for your health decisions and your medical decisions, and educating yourself so that you know what should happen versus what typically does happen. Before we get into it, thank you guys for tuning in to listen to this episode on the code. However you're listening to this podcast, we really appreciate your time. And this story that I'm going to talk about today came from a few weeks ago. A coworker and I were at a rock climbing gym doing complimentary assessments. We were there doing what we call injury screens, where somebody has something bothering them. They're training there at the climbing gym. We've got a table set up. They come over, talk to us for a few minutes, and we analyze what's going on. So this gentleman comes over and he starts telling me about how he's had back pain for approximately 6 months, and he's been having back pain. It's radiating down his leg, and now the symptoms are more numbness than anything else. His foot is numb, the vast majority of it. He's having what we call symptoms of foot drop, where he's struggling to engage the muscles that lift his foot up. So think about the muscles on the front side of your lower leg, of your shin, and he's struggling to engage those. He's not noticing a huge difference in his climbing being limited, except for the fact that his arms are more tired because he struggles to press off of that same leg. So it's not quite as reliable for him on the holds, on the foot placement when he's climbing. But what he is really limited in is this same guy really likes to run, and he hasn't been able to run since this back pain episode started. And just to give you a brief backstory, he injured his back trying to lift something heavy, kind of awkwardly shaped. It was like more than 50 pounds, um, and it wasn't evenly weighted. So, think about something out in the yard that you've ever tried to lift before, or a heavy bag, a heavy box. It's not exactly the same as lifting a dumbbell or a barbell or a kettlebell when you can have the weight evenly distributed on those things. Some of the things we lift up in daily life are not evenly distributed, and that was the case for this gentleman. So he felt some discomfort in his back, and at the moment, or at the time when his back started bothering him, he wasn't feeling those symptoms down the leg. But like a day or two later, he started feeling numbness and tingling and pain down his leg. So, like I said, by the time I met this gentleman, he'd been dealing with this for 6 months. He had been not running for 6 months. He still had his foot being completely numb, or almost completely numb, for 6 months, which is just crazy. And he started to notice some of the strength come back, but ultimately, he's in a significantly worse off place than he was 6 months ago. So what he told me was that he wasn't exactly sure what to do about it. After 3 months of dealing with this, he went to his primary care physician. So he goes to his doctor's office to get checked out for this back pain and the symptoms that are referring down his leg. And what he told me happened at the doctor's office was a very brief assessment. And because he's having symptoms that sound like they're coming from a nerve, he got prescribed a medication called gabapentin. And this is like a nerve pain or a nerve symptom medication. It helps to reduce the inflammation around the nerve, which we know, maybe you and I know this, or if not, I'll tell you, these symptoms are coming from his back. There's some irritation to a nerve, what we call a nerve root, most likely in his lower back, that is referring down his leg, and that's causing the symptoms, the numbness in his case. Depending on the irritation to nerves in your back, the pressure that's on the nerve root, where the pressure is, how much the pressure is, that's what determines what kind of symptoms we have down the leg, whether they're pain, whether they're numbness. We have different, what we call tracts or fibers that run in our nerves that are responsible for different types of sensations. Sensing pressure, sensing touch, sensing pain, sensing hot, cold, numbness. So depending on how that nerve is being contacted, depending on how that nerve is being irritated, That dictates the symptoms that we're going to have. In this gentleman's case, numbness and foot drop. So he's having what we call sensory and motor symptoms, right? That's not good. That's not what we want. We don't want either of those. We definitely don't want both of those. We especially don't want motor symptoms to be impacted, because then we start having other issues. We start having atrophy take place, which he definitely did. If you take a look at his calf from one leg to the other, very different from a muscle standpoint. You can see it plain as day if you know what you're looking for. Um, even if any of you listening to this were to look at his calves and I asked you, does one of these look bigger or stronger than the other one? You would say yes, and you'd be able to see that his left leg was smaller than his right leg. So he goes to the doctor, right? He gets prescribed gabapentin, and that's it. And he's sent on his way and says, just take this, and you should be good. So 3 months go by, and that's when I meet the guy. And unfortunately, he is not good. He's better than he was from a discomfort standpoint compared to 3 months prior. He's taking that medication. But there is no way that just being prescribed a prescription, having dealt with back pain for so long, that should be the standard of care. Like, why is he just recommended take this medication instead of a number of other things that he could be doing about it? You may notice we're not in the sauna anymore. Phone overheated. That's your cue, right? You shouldn't be bringing your phone into the sauna anyways. Do as I say, not as I do. And going forward, we won't try to record any of these in the sauna. But back to the story. So the standard of care for a back pain episode like this should not be, and is not, just prescribe a medication and go about your usual day, right? There are so many things he could do about it, but whose responsibility is that? Is that the physician's responsibility to be the one directing him in what exactly he should be doing? Is that another specialist that the physician should have referred him to or recommended he go see? Or is that the client's responsibility to take their health into their own hands and ask more questions? Like, I don't know exactly what questions the guy asked, but if this was you in this situation and you've been dealing with something for 6 months, it's limiting you from your favorite activities that you like to do, running in this guy's case. He has also got a young kid at home. I think he said he was 4 years old, and he needs to play with him on the ground and go play with him in the yard and stuff. And when you can't run around, that's pretty hard to do when you've got a little kid. So whose responsibility is it? I would argue that there's a huge portion of that falls on the client. And as the consumer of healthcare, if you're given a recommendation, I think you should politely and professionally question that and just ask, like, is there anything else that I can be doing? I'm being given this medication. Hey doc, what else can I do? Is there something else I can do in addition to this medication that is going to help me recover faster? I'm really invested in this. I want to get this better as quickly as possible. What do I need to do to make that happen? And hopefully the physician then would give some other recommendations. You guys, right after this happened, this particular gentleman should have been seeing somebody like a physical therapist, like a chiropractor, like you name it, right? A massage therapist, acupuncture, something that can help with these symptoms, something that can help get the muscles activated that are now atrophying because of the lack of nerve input. Get the relief or get the irritation in the back calmed down, to calm that joint down, to calm the nerves down, so that he can have proper nerve signaling to the muscles and tissues of his lower leg to relieve the numbness and or the strength deficits, those motor and sensory components that I was talking about before. But we go to the physician looking for direction. We're given the big pharma response. Take this medication, go about your day, you'll be better. The unfortunate truth is, if this gentleman only takes that medication, as he's been doing for the past few months, we will see that his symptoms aren't going to improve at the rate that they could if he was doing other things. Unfortunately, that's not going to address the root causes of the issue. Why did this happen in the first place? Is it a lifting technique problem? Is it a lack of capacity problem? Was his body not properly prepared for lifting the weight that he tried to lift on that given day, and therefore he injured himself? Uh, is it a stress problem? Maybe he has a ton of stress going on in his life, and that was the straw that broke the camel's back in this instance. Maybe he's sleeping 4 hours a night, right? In the 15 minutes I got to talk to him, I didn't get to get down to the nitty gritty of all of these questions and answers, but we need to address the root cause. And what just taking that medication surely is not going to do is address the lack of mobility and lack of strength that he now is going to have as a result of not being able to do the things that he wants to do for the past several months and living a less active life than he was before. You need to do specific things to rehab the calf, the lower leg, the back, to rebuild the strength that he's losing from that lack of nerve input. And that can't happen just by taking a medication, just by going back to your normal daily life, because then there will always be a deficit between the one side and the other side, unless you do specific rehab to make up that difference, right? And that goes for every injury, right? If you injure something, you spend time in a boot, you spend time in a sling, you just simply spend time not doing stuff. You need to do some intentional work to make up that difference. It doesn't just come back on its own and be better than it was before. It's always going to be a little less than it was before. And that leaves you at a greater risk for more injury, more limitation, being less active, and your activity level continuing to decline as you age. And I'm a big believer that, we don't stop moving because we get old. That's what a lot of people say. But we get old because we stop moving. And if you can keep doing the things that you love to do, there are plenty of older adults that you would think that they're way younger than what they actually are because of the things that they do, the running, the hiking, the lifting, the whatever, playing with their grandchildren. And you would think they're way younger because they're so active and so vibrant and so full of life. So, the point of this episode is just to encourage and remind all of you guys that you have to be the biggest advocate for your own health. I think we can politely question, whether it's in our office at Physio Room, whether it's in somebody else's office, we can question the recommendations that were given by the health professional in a polite way that doesn't disrespect them, just by simply asking, is there anything else I could be doing? I mean, heck, if a client were to ask me or any one of our providers on the team, what else could I be doing besides the things that you just suggested to me? I'm sure we have answers, right? We may want to dive into the nutrition side of things with that client to make sure they're getting adequate protein, adequate calories, eating whole foods as opposed to a bunch of processed things. We may dive into the sleep side of things to make sure they're resting and recovering. We may dive into other things. We were just talking about the sauna, the cold plunge, whatever. Like, what other things could we do outside of the rehab, outside of the hands-on work, to just put them in the best case possible, optimize the situation around their recovery? So there's always something more for most people that you could be doing. But what should you be doing? You need to ask the right questions. You need to, be the advocate for your own health. And hopefully this gives you a reminder. If you're ever dealing with a back pain situation like that and you have questions, please reach out. But please don't just, wait to go see somebody and then just take a prescription medication and assume that it's all going to get better, because that's not how the human body works. It's going to work better if you do more things. You do hands-on treatment, you do movement-based things to recover and rehab, and not let atrophy and things set in. So, looking forward to working with this gentleman, getting him back to where he needs to be, getting him back to running, and, changing his mindset around the direction he was given from the healthcare system. So I really appreciate you guys tuning in, listening to this episode of The Code. Can't thank you enough. If you've never done so before, a review would go a really long way on this podcast. Scroll to the review section on whatever platform you're listening, drop 5 stars, ask us some questions if you have them, and we hope to catch you on another episode of The Code. We'll see you later.